Mpox, previously known as Monkeypox, is a viral zoonotic disease that remained under the radar for many years, predominantly affecting remote regions in Central and West Africa. Initially discovered in laboratory monkeys in Denmark in 1958, it wasn't until 1970 that the first human case was documented in the Democratic Republic of Congo. For decades, the virus lingered mostly in isolated areas, transmitted through close contact with infected animals, including rodents and primates, despite occasional outbreak in the regions. Mpox remains a largely obscure illness. However, Nigeria's struggle with Mpox began in earnest in 2017, where the country reported its first major outbreak since the 1970s. This marked the beginning of a new era of viral transmission in the region. The 2017 outbreak set the stage for Nigeria's ongoing battle with Mpox, where human-to-human transmission started becoming more prevalent. Over the years, the frequency of Mpox cases in Nigeria increased, and by 2022, the situation had escalated. Between 2022 and 2024, the Nigeria Center for Disease Control recorded numerous cases across the country, spanning over 20 states, including the Federal Capital Territory, Abuja. By 2024, Nigeria had documented 48 confirmed cases of Mpox, prompting widespread public health concerns. In response, the Nigerian government collaborated with the international health bodies to strengthen efforts to contain the spread of the virus. One significant development occurred on August 27, 2024, when the United States provided Nigeria with 10,000 vaccine doses, offering a critical lifeline in the fight against the virus. Despite the alarming rise in cases, no fatalities had been reported in Nigeria, showcasing the mild nature of most Mpox infections. However, health experts remain cautious, knowing that the virus's ability to spread and its potential for severe cases required constant vigilance. As the virus spread through 20 states, Nigeria adopted various measures to combat Mpox, from rising public awareness to strengthening healthcare infrastructure. The NCDC and other public health agencies embarked on educating the general public about the transmission and symptoms of the virus, stressing the importance of hygiene, avoiding close contact with infected individuals. A crucial component of Nigeria's response was the introduction of a health declaration form for international travelers. This measure aimed to curb the potential importation and further spread of Mpox, considering Nigeria's interconnectedness with the global community. The form required travelers to disclose recent health conditions and travel histories, allowing authorities to track possible exposure points and prevent new outbreaks. At the same time, local governments, with guidance from the African Union, declared Mpox a public health emergency. The rapid transmission across the continent heightened the urgency for widespread vaccination campaigns and coordinated efforts to manage the crisis. Mpox spread primarily through direct contact with infected animals or individuals, as well as contaminated materials like bedding or clothing. While the disease symptoms can range from mild to severe, most cases in Nigeria followed a relatively mild course, with recovering occurring within 2 or 4 weeks. Symptoms usually manifest 5 to 21 days after exposure, beginning with fever, swollen lung nodes, and body aches, followed by a distinctive rash that developed into lesions. Despite the discomfort and occasional complications, most Nigerian cases were manageable through supportive care with antiviral treatment like tecovirimat reserved for severe instances. As Nigeria continues its battle with Mpox, public health officials and the general population remain on high alert. The country's proactive response, including the shipment of vaccine and the implementation of stricter health protocols, has made significant progress in containing the virus. Yet, Mpox remains an ongoing challenge.